each village has anywhere between like 5 and 15 of these women. And we train them because there are 1.5 million of them across Indonesia that have never had any training, right? So the way that we think about it is like, can you imagine all these frontline village health volunteers, the people who are supposed to be telling you that when you're pregnant that you have to go to a formal health facility 4 times, that you have to take iron and folic acid, things around diet, these kind of things, like they've had absolutely no training. So in a very brick and mortar way, we train these guys. This is a place where there aren't a lot of smartphones. There's, you know, like for us to do webinars and train the trainers and these kind of things are extremely difficult. So we sweat it out in the village and we train these folks. And a lot of the times, in order to create better accuracy with regards to data, we have to work with the sub-district health facilities. And we've had extremely good luck with the sub-district health facility here in Flores, where I am now, doing my quarantine. They've become like family over the last 2 years. And so, yeah, so when the virus hit and everything went sideways, we were like, we can't let them fight it alone. So then we started the page for Give Asia. We reordered things as an organization, but yeah, we didn't want to let our friends in Flores fight alone. Like I said, they've been like family. So we called Pa Vincent, who runs the hospital, and we called our friends Burina and Buemi, and we said, hey, what can we do? How can we help? And it started from there. And so now I think we're close to 25,000 on the Give Asia page. And I'm here in Flores. We're doing everything we can. So like tomorrow I'll make DIY hand sanitizer. We've already distributed over a ton of soap. We've also distributed over 200 masks, gloves, boots, all these things. We've got couriers in Jakarta that have shipped stuff for free. We've got soap companies that have given things for free. Yeah, because we don't want to let our friends fight it alone.
That's very good to hear that, you know, you are there on the ground making real impact. One question I have is that how do you then communicate with the frontline workers, these healthcare you know, workers in this kind of situation where they might not even have access to smartphones, right?
Sure. So again, it comes back to the district health facility, our friends there. So Pa Lius, for example, his phone is worth $1 million. It has everybody's phone number on it. And also when he calls people, they listen, right? I think when I call them, they think it's really cute that it's an American who's speaking really, really bad Indonesian. But when Pa Lius calls them and he says, hey, look, there's a meeting, or hey, look, I need you to give me the numbers on how many kids have upper respiratory infections this month, people listen. And I think, you know, like all good things, the relationships matter. Pa Lius has an amazing relationship with those frontline health volunteers. And we have an amazing relationship with him. That being said, we've also started a WhatsApp group for the cadres, for the frontline health volunteers that have WhatsApp. So inside of that group, we send everything from DIY videos to, we've talked to some celebrities here in Indonesia, and they've sent motivational videos, right? Telling people like, look, you guys are the tip of the spear. You guys are the frontline workers. So we sent out 3 of those last night, and everybody's gone nuts over that, which is fantastic. Yeah, and again, right, like in Indonesian, it's called ujung tombak, tip of the spear. And it's true, right? And so whether it's hand washing with soap, whether it's making sure that you're eating healthy, those are the people who are getting the messages out in the villages.
I kind of see a common theme in your stories, which is like you have played the role of a connector, you know, whether it's kind of connecting, you know, the humanitarian world with on-ground efforts, you know, to kind of push healthcare. Then also you're talking about like, you know, connecting the celebrities with the donors. So I feel like a lot of your work revolves around bringing disparate worlds together and kind of, you know, creating like a win-win situations for them. Is that something which you grew up with, or is this something which you have kind of learned over time?
I think I've just learned over time that this is what works, right? Like I'm happy to be the glue. as my team will tell you, like when it comes to details, I could be a lot better. I think my team would also tell you when it comes to self-promotion, I could be a lot better. I think when it comes to talking to donors, I could have a bit less more shame. So because I'm weaker in these, I mean, I think, you know, there's a phrase that writers use. It's, you know, it's cook what you can't burn, right? And so I found that what I bring to the table is that ability, I think, to connect people. I think, what I make up in inability to do Excel with the ability that I wish I did, I think I make up for in connecting people.
That's amazing. You're focusing on your strengths, and that's really cool.
Yes.
Could you share with me about the branding and the messaging that you have at the 1,000 Days Fund, and how does that resonate with your supporter base?
The branding and the messaging. So for us, we want to keep things as simple as humanly possible, right? We know that we have a number of audiences. We have our policymaker audience. We have our donors. You have experts in the field, and then you have, honestly, the people that really matter, which are the moms and the dads at that village level. And it's really like, it doesn't get any better than just keep it simple, stupid, right? Like, for example, and you only learn this when you're in the field, right? So if we talk about exclusive breastfeeding, and in Indonesian, you would say ASI exclusive. That doesn't translate at the village level, right? And there are other things, right, around like portion versus like a plate of food, these kind of things, but things that you learn at the village level, and you only learn by doing, right? Our height chart, we've installed 12,000 of them across 25 islands. The version that we have now is, I think, version 13, but it's just a thing of where, you know, when we designed it in Jakarta, we said, we've had amazing help from like special staff to the president and people at the Ministry of Health. Those people have PhDs, and they said, okay, this is great. And then we took it out in the field, and people were like, what's this? There's too much information. There's not enough information. And so our messaging has always revolved around this thing of knowing your audience, right? So I am not our audience, right? So I think one thing works, and that's great. It doesn't matter what I think. It matters that I can actually take the product, show it to the people in the field, and they say, okay, cool, this is what I understand, and this is what I take away from it, right? So yeah, we keep it simple. We try to make sure that whoever's delivering the messages are people that the people who we want to hear the messages from, those people care about, right?
That's great. And where is your supporter base, the donor base, generally from? Is it from Indonesia or from all over the world? Or what are some of the common traits of people who are supporting your organization and your efforts?
Great question. We have an extremely vast donor base, right? So like, it's everything from people who have seen us on Instagram and then decided to give us $2 because they thought, wow, this is a really cool deal, and you guys are actually working in the field, to private sector companies in Indonesia, right? So like, we're talking to like the Roches and the RMBs and those kind of companies in Indonesia. Singapore has actually been really, 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 really good to us. I can't exactly put my finger on why, but we've done, folks in Singapore have been tremendously generous. I think people see how important it is for us to, as an NGO, to keep things small, to spend a tremendous amount of time in the field, and I think people respond positively to that. I think people appreciate that as donors.
Yeah, I think the more you can make a tangible impact for people to actually see where their donations are going and who's the individual at the end of the day who's benefiting from their donation, I think the stronger is their I would say interest in supporting your organization, talking about your organization, because definitely bigger organizations face this challenge where they raise funding and it's difficult to kind of pinpoint exactly how the funding has made a tangible impact, right? So I think that's one of the benefits of being an agile organization.
Yeah, I agree with that. I also think though that we do a good job of splitting depth and scale, right? So of course everybody wants scale, right? But when you go to scale, you lose that depth, and you use that. You know, we talk about it in terms of high fidelity, right? So I know right now, if you ask me about a village in Flores, I know all five kata, right? It's Bulina, it's Bufifi, right? It's Atika. I know those kind of things. And again, like scale is great, but I don't know if I would really change the connection that we have with the Ragils and the Bufifis and those. Like I don't, because when we lose that, yeah, then I think we lose sight of what we're really after.
Yeah, I think that's a great point. I mean, being on the ground, and you mentioned it before, I've talked to other change makers, and they always share with me that, you know, the initial concept that they had of how to support the community was very different from what the community actually needed. And I think, like,
Oh,
you know,
for
that's
sure.
kind of like the journey that you have to go through to understand that people on the ground have a better idea of what works, what doesn't work, and you know, how you can support them in that journey, right?
Yeah, I think so. I was lucky, right? I was a Peace Corps volunteer right out of college. And so then I was in Mauritania for 27 months, no electricity, no running water. When I was there was only 2 paved roads. That country's 2 times the size of France. And so like I built basketball courts that fell apart like the only time it ever rained. I built libraries that nobody went to. Built like neem tree nurseries, and then gave trees away and nobody ever planted that. I think like failure is tremendously important, and I think, you know, when you go for a big NGO, you don't get that kind of stuff, right? But I think, yeah, I think, yeah, because the donors don't want to hear about it, right? Whereas the reality is it should be celebrated, because if you're not failing, you don't really know anything, right? And we've made tremendous mistakes, just like with the height chart, for example, right? Like putting the wrong tree up there on the first place. But again, back to bringing it back to the field, right? You bring it out to the field and people are like, what tree is that? And we're like, oh, that's this kind of tree. And they're like, we've never seen a tree like that before. And we're like, okay, cool. We got to note that down. And yeah, I think it's just you're just iterating all the time. And you also, like, there's a certain sense of humility that you have to have, where you say, like, I'm not married to any idea in particular, right? I'm, you know, like, what do people talk about? They talk about, like, you fall in love with the problem. So if you're in love with the problem, then you should be like, you should be running toward failure, right? Because then that's how you know that you're actually testing new things as compared to just doing the same old.
Yeah, I think that's a fascinating point. And actually, I'm making notes as well, because I think you really, really hit the kind of nail on its head, which is that, yeah, you want to go towards uncharted territory to learn new things and then apply those learnings into what you're already doing. And in some ways, I would say COVID crisis is pushing people into that direction, right? Like we are all kind of having to re-question the way we operate and, you know, the way we work. I want to go back to that point when you decided to start a fundraising page on Give Asia. Like, you know, what was the trigger, or how did that happen? How did you hear about Give Asia? And yeah, essentially, what was the kind of like a few events that led to you, you know, using Give Asia to raise funds online?
Sure. So my boss, actually, Simon, was the one who said, look, hey, there's a lot of attention around what's going on. Can you create a Give Asia page? We done fundraising pages in Indonesia in the past with Keith the Beast. The guys that run that are fantastic. But we wanted to try something new, and I'm not trying to be too nice or trying to kiss up to you, but like the page is just really easy to set up. And then I told you before, like Lynn reached out to me immediately and made everything really easy. And then I think the thing for me was, it was just really easy to share. So I think I've learned over the years from fundraising, like, I don't need everybody to give me money. What I do need is everybody to share it, right? And it was just a really easy thing to share. And it was really easy to tell a personal story about what we were doing and how we got to that point. And then it just took off from there, right? So it was a mix of people who got it, people who understood, like, wow, because these guys have a relationship on the ground, because they know these folks in the Puskesmas, in the sub-district health facility, because we know it, we know them personally, it just made things easier.
Yeah, that's great to hear. What is the best piece of advice that you have received in terms of like, doing the work you do? If you were to share any piece of advice with other change makers, like what would you say?
Sure. I have a lot. I think my two favorites are one is perfect is the enemy of good. I think a lot of people become obsessed with perfect is the enemy of good. You can take it however you want, but the reality is, if you genuinely want to help people, you learn by doing. And then the second one that I would say is, it's my favorite. If I was a bit braver of a person, I would have it on my business card. But it's a quote from Mike Tyson, and it's, everybody has a plan until they get punched in the face, right? And so it's this thing of, like, we build all these fieldwork agendas and we build all these things, but look, man, like, you go out in the field and you're supposed to go to 4 villages and 4 islands in 4 days, and then somebody gets sick or somebody has a birthday, or all these other things, all these other factors. And for me too, I think about it like that ability to be flexible. I'll take that over any fancy degree or any anybody's I don't know, any accolade. I'll take ability to be flexible and just roll with the punches over anything else any other day.
I think that's great advice. I will ask a follow-up question to that. How do you build that as a culture, like in your organization? Like, what are the steps that you can take to actually make sure that everyone in the team actually lives by that culture? And I want to say it specifically for maybe Asian culture, right, where failure can be a taboo, where it can be kind of a bad thing if you're failing, in terms of, like, the cultural context as well.
So I think it's your responsibility as a leader to lead by example, right? And that starts, I think, by, like, apologizing, taking responsibility, saying you are wrong. Those are different versions of what we're after. I think it's really, really important for me. Like, I don't like when people say things like, I misspoke. No, you didn't. Look, you were wrong. Just say you were wrong, right? Like, I think, the people who I trust and believe in are people who take responsibility for what they do. And I think that lends itself to that culture of I guess, embracing failure. But call it humility, call it whatever you want. But taking responsibility, I think, is a way to build that culture.
Any books that you would recommend, or any resources that you would recommend?
So Mountains Beyond Mountains. It's the Tracy Kidder book about Paul Farmer. I love that book. The Idealist. The woman who wrote it, her name escapes me, but that book about Jeff Sachs, right? I think it's really important. However you think of people like Paul Farmer or like Jim Kim or like Jeff Sachs, I think both those books teach you to see people in different light. Off the top of my head, those are two books that I really, really like.
That's great. I want to go back to that theme of, like, being that glue and being that integrator. I think this is a little bit broader question, but there would have been times when you are working with stakeholders with very different methods, right? Perhaps they are looking to achieve the same end goal, but the way they want to achieve might be quite radical or quite different. What are some of the ways that you have, like, used to overcome those kind of I would say, like differences in opinions?
Sure. I think the most important thing is to listen, right? I'm continually trying to remind myself to, and it's hard for me because I like this talk, but to talk about, a third as much as I listen. And so people want to feel heard, right? And as long as you can make different stakeholders feel like they're being heard, then I think you get closer and closer to common ground. And it's really about compromise, right? No one person is going to be right. Everybody's going to add to the conversation, and then you're going to have to be a grown-up, and you're going to have to find a compromise. That's with donors, that's with a team, that's with stakeholders. I think, yeah, the ability to listen and the ability to seek compromise, like you don't have to be right. Like being right is worth nothing, but being able to find compromise, I think is what the end goal should be.
Okay, that's a very good point. What is the biggest challenge right now, given the COVID situation, in terms of carrying out your operations the way they used to be in the past?
Sure. Thank you. So people can check out the page and see the photos of what it's like for us, one, to procure, and two, to distribute. The biggest problem, I would say, is there are so far no cases of COVID here in Labuan Bajo. That is for a number of reasons. Probably most of all, there's no testing. So I think that's ground zero, is a place where we are not even testing people, right? The other thing that we think about is there are roughly 300 frontline health volunteers, frontline health workers that we need to keep safe. And so when we think about the runway, we need to keep people safe for at least 3 months. Yeah, this is not about, like, I see all kinds of organizations that are just throwing everything that they have at the problem. And honestly, like, you got it, like, this is a marathon, right? And for us, we're thinking long term. So we're thinking in 3 tranches, like 3 1-month tranches, right? And we just want to keep people safe. A lot of people are reading a lot of things about all these modeling and these kind of things. I'm actually reading a lot of stuff about Ebola in West Africa. And the bottom line there was the frontline health volunteers, the frontline health workers, they didn't feel protected. And so the health system collapsed. Obviously these people are our friends, right? I wouldn't be able to live with myself if, Bu Rina or Bu Emmy got sick because I didn't do enough to. So yeah, so the biggest thing for us is getting people to understand that we need all the help that we can do to get us 3 months down the line. This is not going to be over in a week, right? And it might not even be over in 3 months. So it's a long runway.
What does that translate into the funds that you're trying to raise for
Sure.
covering these needs?
Yeah, so the goal now is 45,000, and then, but I think I would say before I say that, right? Like, again, back to the point I was making earlier about sharing the page, right? Like, 20 shares to me is worth more than somebody giving money, right? Getting that word out is really important to me. Then I would say that the reason the goal is 45 is that we are thinking in terms of 3-month tranches at 15 each month, right? So the easiest way is think of it in $10,000 of that being personal protective equipment, and then we have other chunks of that money that are going toward, like, DIY programs, like trying to figure out how we can do hand sanitizer here on the ground, how we can get tailors to sew masks. Because the bottom line is, as the supply chain slows down, we're out in the middle of nowhere, right? If we were in Jakarta, this would be a different game. But for example, if my team in Jakarta puts something on a boat, I'm lucky if it gets here in 10 days, right? And so we're going to get to a point where we don't have 10 days. So we're using that money to get people to test ideas around making their own field or face shields, distributing soap, because we want to keep people out of the health system, right? The more people who are washing their hands at the village level, and the more people who are informed that if they are not, if there's no shortness of breath, they can beat it with Panadol and Pocari Sweat. Getting that information out to people, and then really just keeping our friends safe so that nobody wants to go to the hospital and then know that they might be able to bring something back to their family. Again, that's how the health system collapsed, and nobody deserves to work in an environment like that.
Yeah. No, I think that that's very important. It all starts from keeping the health workers safe, giving them the confidence that they can go to the work and be protected. And what you really mentioned, it's about keeping our friends safe. And I really commend you for making this happen. Last question I have for you,
Sure.
Zack, is if you could put a message on a billboard, what message would you put on a billboard?
Yeah, was if I could put anything on a billboard, what I put on a billboard. Yeah, with love, compassion, and solidarity, we'll get through this.
Nice. Yeah, I really love that. I think that's a much needed message for this current time. I would just open it up to a few attendees we have. If they have any questions for Zack, please feel free to share those questions. I'm going to actually allow all the attendees to be able to talk. So I'm just going to allow them to talk. Guys, please feel free to ask any questions that you might have. Michael, Sally, and as well as Sissy, do you guys have any comments, any questions, any things you'd like to say? So Zack,
sorry.
Yeah, go ahead. Go ahead, Michael.
Hi, Zack. I'm particularly intrigued as to how this work you're doing now, obviously it's very urgent, and what's going on there. But how do you see this integrating with your longer term work for anti-stunting?
Thank you. It's a great question. So so first and foremost, our thing has always been, one of the things are hand washing with soap, right? So doubling down on that, and it also feeds into the programs that we already have established around proper hygiene, access to water and hand washing with soap. The silver lining in all of this is that because we got to it early and because we got soap out there, we're doubling down and hoping that those good habits form and stay with folks for a long time. Again, if you check out the Give Asia page, you can see just photo after photo of people that are washing their hands. I think it's a small thing. Soap isn't sexy, but it saves lives. I mean, the team was out here over a month ago. There's still kids dying from diarrhea on Rincha and Komodo, and hand washing with soap saves those lives. So I think maybe, as we turn the corner on this, we're going to be quick to tell people, look, in the same way that you stayed safe washing your hands with soap during Corona, that hand washing with soap is going to save your kid from stunting.
Thanks.
Thank you.
Thanks, Michael. There's actually another question we have here, which is, how does it feel to be in Flores right now, given the current situation?
I mean, I think if I would have stayed in Jakarta, I would have been more worried, right? I guess I'm grateful to my wife for letting me come here. I have pictures. My daughter drew me some pictures, so I have those. So I feel like I'm home. But I think it's like I said before, it's about solidarity. So it's about being here for people.
Thanks, man. I want to really salute you for doing what you're doing, making real sacrifices to be away from your family and, helping people who are in dire need. And it's really what you said, right? Like it's in times like these, it's compassion, solidarity, love that's going to, get us through this. I think from me, that's all. Zack, could you share the website where people can go to donate and also, more importantly, share about your story and your campaign?
Yeah, just real quick. So the page is it's the 1,000 Days Fund Give Asia campaign, soap and supplies for Flores. I think really what I would say is how grateful we are to everybody who's already just, I guess, come through so huge, right? We had no idea when we started that it was going to be this big. And I just, yeah, I think it's a thing of gratitude more than anything.
Thank you.
So
Thank you.
Sally,
Thank you so.
CC, Michael, thank you so much. Not only for making the time, but also for being such a huge factor in this, right? I'm incredibly grateful.
Thank you everyone. Thank you, Zach. Thank you all those who attended. And we'll also be putting up this on different social media channels so it reaches more people. What you're doing is wonderful, Zach, and it needs to reach out to more people. And at Give Asia, we are very glad to play small part in spreading your message and raising awareness and funds for it. Please keep doing what you're doing. And yeah, we are always a phone call away. So, anything, just feel free to reach out to me or Lynn. We definitely want to do our best to, get you to that target that you have for the next 3 months. So, let's work closely to get to that. All right. So you have a good day. Thank you so much. And
yeah, thank you.
We'll talk soon.
Thanks, CC. Thanks, Sally.
Thanks. See you. Bye.
I appreciate it, man. Thank you. Have a great day.
Thanks. Bye. You too. Bye.